Hi, I'm Bill Bean. I'm the Director of Nursing here at CHR.
Hi, I'm Courtney Sheehan, Licensed Professional Counselor, Senior Program Director here at CHR. Bill, let's talk a little bit about cardiac issues and how they impact the folks that we care for at CHR.
Sure, and it's a good topic to talk about. Cardiovascular disease, unfortunately and tragically, is one of our leading causes of death for our clients here at CHR. And it really boils down to untreated cardiac disease or undertreated cardiac disease. And the real irony here is that most of the things that we're talking about with cardiovascular disease are things that can be treated in your primary care physician's office on a routine outpatient basis. And the key to success is starting early and staying in care.
I'm glad we're talking about primary care because caring for folks with mental health and substance abuse issues, it's important to be reminded that there's not always equal access to high quality primary care that works for our populations. And so it's important to be thinking about building partnerships in the community with primary care practices, referring to places that work for our clientele, and thinking about referrals to family medicine in Enfield, which is a trauma-informed primary care practice here at CHR.
Yeah. So I think that you're really touching on a larger topic that is, in general, folks with mental illness generally maintain engagement in primary care less well than those without, okay? And some of it is the symptoms of the mental illness, and some of it is the social determinants of health that our clients just experience too much of, right? So a key thing that we can do is, when we're working with a client, is to help them find their way, help them attend primary care appointments, help them find a primary care provider that they feel like they can work with, that they're listened to, right? Some primary care practices are very geared in such a way that for our individuals, their mental health symptoms almost exclude them from care. Things like if you're over 15 minutes late for an appointment, you need to reschedule. Things like that can be real barriers for somebody living with depression or somebody living with social determinants of health, like problems with transportation, right? You may be late, right? It might sound like a 20-minute car drive to your PCP office, but for somebody without their own transportation, it's a bus ride and a transfer and an extra token and walking 3 blocks, right? Which may be a lot.
And let's talk a little more about the mental health impact. So what we know is that for people with cardiac issues, there are much higher rates of depression and anxiety. And what we know is that untreated depression can actually interfere with cardiac care, and it can result in more problematic outcomes and higher risk for cardiac events.
Yeah, absolutely. And, some of the symptomatology of both cardiac disease and depression, what do we know? Less endurance, right? Harder to, move our bodies around and get things done, right? Feeling less of an ability to get up and start the day and get things done, right? So it's almost like there's an extra burden. For somebody with depression and cardiac disease, it's almost like there's a cumulative effect.
Yeah. I mean, we're really talking about an integrated care approach here, right? Looking at the whole person and how their behavioral health conditions impact their medical conditions, and medical conditions impact their behavioral health, and taking, again, that entire whole person approach. So when I think about myself as a behavioral health provider and I reflect on the things that I can do, I can share that, it's important to ask the people working about their health history, about their, if they have any cardiac issues, and have a conversation about how they're feeling and having a good assessment in that regard. Important to advise, provide the information that, there is a link between mood and cardiac issues, and to be referring. So we talked about high quality primary care. Certainly access to high quality mental health and substance abuse treatment is important. And the role of wellness. Wellness is a really important resource and toolkit to help folks that are managing cardiac and behavioral health issues. Can you talk a little more about wellness supports?
Sure. And, you know, I think it's so important when you're talking with somebody about their chronic disease that you start off with the tell me what you know, tell me what you've heard, right? Because that way we get, you know, a placeholder of where our client is starting off with their understanding, right? It may be a younger person living with advanced cardiac disease who lost a relative of advanced cardiac disease at a very young age and thinks to themselves that this is their future and there may not be anything they can do about it. And you can imagine how that contributes to depression and anxiety, those kind of beliefs, right? So understanding where we start and where to begin the dialogue is really pivotal to success, right? Helping to increase that understanding. And one of the great things that we have right here in our own back pocket at CHR is some of our wellness groups. Certainly the new R group is a great opportunity for somebody that's managing, you know, cardiac disease, because we're just talking about being healthy in that group, right? If they're using tobacco, getting them connected with tobacco cessation, nicotine replacement, and focusing some of the therapy on that addiction can go a long way, right? Cardiovascular disease is debility by inches, right? So every risk factor that we can minimize, every issue that we can take out of the equation makes for a healthier patient with hopefully a longer life.
Sounds like there's a lot we can do to start the conversation.
Absolutely, and never underestimate the value of just talking with somebody about what they understand and helping them understand more and exploring things together and finding out new answers and new opportunities is a powerful intervention.